Is your back to school authority, and a lot of students are heading back to the classroom for the first time in more than a year. So we are speaking with experts to help answer your questions about school life during a pandemic. Joining us now is Dr. Faiqa Cheema, an infectious disease specialist from Hartford Hospital. Doctor, thank you so much for being with us.
Thank you for having me.
So I think a lot of parents are obviously concerned and nervous and have a lot of worries, especially because right now no one under the age of 12 can be vaccinated. So I think one of those concerns is there any way vaccinated teachers can pass the virus to unvaccinated students?
So the D in the Delta variant stands for different. Science has shown that the Delta variant is more transmissible compared to the original wild type virus, even amongst vaccinated people. So even though you're vaccinated, you can still transmit the Delta variant from one person to the other. What does this mean for all of us? This means that teachers, school staff members, and even students, regardless of the vaccination status, need to observe universal masking. Why is that important? Masks have shown to provide an extra barrier of protection and have been shown to be very beneficial in reducing transmission of the virus.
Another question that we have been getting is talking about the double whammy of flu season and COVID-19. Is there anything I can do to help my kids boost their immune system as we go into flu season and deal with COVID-19 risks?
It really comes back to the two basics. We need to educate our children to wash their hand, observe good hand hygiene, and to make sure they're masking appropriately. The mask that they're wearing is the right material. It covers their face, nose and mouth, and fits their face appropriately. By following these two simple steps, you can avoid many respiratory viruses.
I know I was looking into getting my daughter some back to school masks, and I know this is a concern of many parents. Does it matter what kind of mask we send our kids to school in? Is a cloth mask or a paper mask any better?
So not all masks are created equal. When you think about cloth masks, the weave of the cloth makes a big difference. The more tightly woven the cloth material is, like 100% cotton material, the more effective it is in reducing transmission of aerosolized droplets from one person to the other. So for example, a cloth mask made up of 100% cotton has the right amount of weave in it and is a good bet. When we think about surgical masks, they prevent transmission of droplets close to about 85% and N95 close to 99%. But I think we want to save those for our healthcare workers, the surgical mask and the health grade mask. We should stick to using the right material for the cloth mask for our children as we get ready to go back to school.
All right, a lot of good information there, Dr. Faiqa Cheema. Thank you so much. We really appreciate it.
Thank you so much.